Hello, Raleigh. Welcome to Monday's edition of Your Backyard with Dr. Lovelle. And Dr. Lovelle, thank you for joining us. We always appreciate you spending time with us.
It is always a pleasure.
How are you doing in day 563 of the quarantine?
Dear. We're counting the slow count, right? I see.
Right, yeah, maybe I'm projecting my
A little,
feelings a
little bit.
little bit.
Hanging in there, actually doing really well.
Um, well, I know you're staying inside and wearing your mask and doing all the things. You've certainly been an example for all of us, Dr. Lovelle. And I feel like there's just a real lack of leadership in this. And I feel like there are a lot of political lines and there are other lines in our society that are preventing us from taking the basic steps to protect ourselves, right?
I understand.
Okay.
When I look at it, I wonder why there is such a confusion about something that seems as simple as masks. And so I've looked at both ends of the spectrum. And what I finally came to, one of the reasons why I decided to wear a mask and why I guess it's not that big a deal for me is because I'm a surgeon. I've worn a mask for 20 something years. And the question I would ask people is, would you want your surgeon not to wear a mask during your surgery?
Uh,
The mask is there to protect the other person,
right,
there to protect the patient. And so I don't think there's anybody who would say that no, that they don't want their surgeon to wear a mask. And so
right,
it's really just a matter of courtesy and taking care. And the other
right,
thing is we don't know yet at this point. We're saying this is a novel, they call it a novel coronavirus, which means we have never seen this before. So we don't know how it's going to act. And it only makes sense to be as careful as you possibly can, at least in these stages.
right. Well, I certainly agree. I would certainly want my surgeon to wear a mask and please wash your hands and maybe put on some protective garments at the very least. So that's a fine example. Thank you. I'm going to turn it into a meme and take credit for it. um, but I hesitate to ask for the numbers because I already know what they're doing. They're going up, up, up. But,
Yeah.
any update on the numbers, Dr. Lovelle?
Well, last week, when we looked at that wonderful map that's color coded to make it so easy to see the trends, last week there was a lot of green. Unfortunately, there is a lot of red this week. So we're seeing numbers rise around the nation. And actually, in some states, things are being pulled back.
Right.
Hmm.
Um, Texas, they're actually backing up because they ran forward too quickly.
Yeah.
Um, um, well, can we talk about again the lack of leadership real quick? And I'm going to bring this back around to our backyard, but I, I keep waiting. Maybe I'm not overly in tune to the mass media. I usually just keep a close eye on Raleigh, Wake County, but I'm not seeing on a national level people stand up and say we need to wear a mask. Am I missing that? Is there, it's not going to come. Maybe the governor's doing a pretty good job, kind of. What's your take on that? Is that just me, Dr. Lovelle?
No, it's not. And I think a lot of it has to do with, as mentioned before, is that there isn't even consensus among scientists about what we should be doing. Most say yes, wear a mask, but there are enough who are saying no, it doesn't make a difference, that there's confusion. And once there's confusion, people are not going to make a decision, they're going to make a decision that most serves themselves. And so it's really about, as I mentioned, looking at it from a standpoint of, from care for another, and
Right.
what you would want done for you.
It is so easy, really, frankly. Well, the numbers are going up. Dr. Lovelle says again and again, and we all support her. She is our local leader on this, and you have been very gracious with your time and expertise. You've brought me a great deal of comfort. So, as a local leader, we could have not have asked for a better one. Thank you, Dr. Lovelle.
Thank you.
Um, and so let's just pivot real quick. How are things going for you? We don't always get the chance to catch up, but I hope you're doing well and your business is growing.
This is actually, I said, a point where people are seeing that they really need to take control of their own lives. And that's what I focus on. So We know that with COVID-19, it's people who are older. You can't do anything about getting older, but it's also people who have those chronic conditions like diabetes, high blood pressure, obesity, lung disease. These are the things that we can make a change in and a dent in by changing our lifestyle, changing how we're eating, things of that sort.
Right. I also find when you focus on it, your layers of risk all come, age is going to happen, but you can lose weight, you can boost your immunity. There's a lot of ways to turn layers of risk into layers of safety and health.
Absolutely. Yeah.
And that's where your hand on the tiller comes out a big.
That's what I do.
Um, well, if remind us then, if you need some help, how do we get in touch with you, Dr. Lovelle?
Okay. Well, the best and easiest way would be to call, which would be 919-925-5910. And on our website, we always keep updated all of the webinars and master classes that we're doing and the events. So that would be another way.
Well, that's fantastic. I've already got a friend I'm going to call as soon as we hang up. Thank you for your hint and help on that. And Raleigh, from your backyard, from Dr. Lovelle, local hero, all around great doctor here for you. Please wear your mask, wash your hands, social distance, and join us here again next week because all of this and more is right here in your backyard. Thank you, Raleigh. Thank you, Dr. Lovelle.
Thank you.